Hello and welcome to The Wizard and the Priestess. I'm your host Matt, and in today's episode, going to share an aspect of therapy that most therapists overlook or don't really give enough credit to, and that is the Dura and also a little bit of the craniosacral system. And I'm bringing this up today because in clinic you see trends. So for example, you get a period of time where people come in with jaw dysfunctions or atlas issues or SIJ issues, sacroiliac issues, leg length, and you just get a string of people. And lately I've been able to work with people who come in with lower back pain being driven by sacroiliac issues, which has actually been driven by the Dura and the craniosacral system. So I can share some tips today to help potentially alleviate some of that, because by the time symptoms show up in a joint or joint complex or a muscle that's far away from the upper neck and the head, it's likely been driven from somewhere else. And by the time it gets to the lower back or the knees or wherever you're feeling it, it's likely been around for a while, potentially even decades. Because keep in mind, the body is a master compensator, and when we do experience pain, it's essentially the body saying, I can no longer effectively compensate any further. So an overlooked aspect is working with the Dura. And people don't know what the Dura is the outer layer covering of tissue that surrounds the brain and spinal cord. So it's literally the outermost part of your central nervous system. And our central nervous system records everything we do, think and say. And if you've had any kind of life, you'd have some sort of trauma, be it physical, mental, emotional, and it would have been recorded somewhere in the body. And it might get recorded in the brain, it might get recorded in the liver, tissue anywhere else, but then the symptom days, weeks, months, years, decades later might show up as knee pain, and you just don't know where it came from. So the body hugs tension, and the tension that we hug, it's only a micro tension, but the entire body, including the fascial system, will hug that tension. It'll only be a subtle compensation, but essentially with that compensation, if you were to grab your t-shirt or whatever you're wearing on the right side, at the bottom of the rib, twist the tissue or twist the shirt, and you can feel your body wanting to hug that tension. So that's exactly what happens on the inside, and that can affect the way organs work, tissues work, fascia, muscle, joint mechanics, nerve mobility, vascular mobility, and the effects of essentially the body working properly. So a little brief description into that system. Now the craniosacral system is quite recently discovered. It's a semi-closed hydraulic system contained within like a tough waterproof membrane, which is what we call the dura mater, which envelopes the brain and the spinal cord. An important function of the craniosacral system is the production, circulation, and reabsorption of cerebrospinal fluid. Cerebrospinal fluid is produced within this craniosacral system and maintains the physiological environment in which your brain and nervous system develop, live, and basically function. So normally the production and reabsorption of cerebrospinal fluid within the dura mater produces a continuous rise and fall of fluid pressure within that system. So the semi-closed hydraulic system expands and contracts to some extent with like a rhythmical pressure fluctuation, and this accommodation prevents pressure from building up too much within that craniosacral system. If for some reason your body is unable to accommodate the pressure changes, the subsequent build-up of pressure can contribute to dysfunction and ill health, especially within the central nervous system itself, which is enclosed within the boundaries of that craniosacral system. I think it was the father of what we know of as osteopathy. I think his name is Dr. Andrew T. Still, if I remember right. But he did a lot of research and came up with the concepts of cranio-osteopathy. And basically, they came to the conclusion that the body functions as a dynamic unit. Structure and function are interrelated. A lot of chiropractic, physio, osteopathy principles are based around structure dictates function. However, it being a two-way street, I've found structure does dictate function, but dysfunction dictates structure. And the body itself, as a self-regulating system, which is always searching for its own homeostasis. And a lot of all the foods that we have, the drugs that we take, including medicines, all of these do have an effect in some capacity. So it was first discovered around the mid-70s, if I remember my research, by studying fresh cranial bone specimens rather than the chemically preserved specimens that were studied by researchers back in the day. They demonstrated the potential for cranial bone movement using optical and I think electron microscopes, which showed the existence of blood vessels, nerve fibers, collagen, elastin fibers within the cranial structures, so within the bones of the head. So there are actually 22 bones that make up the skull, but there was little evidence of what's called sutural ossification, which is essentially mean bones fusing together. And that would prevent the movement of the cranial bones in relation to each other. So they did extra research with precise measurements of the frequency and amplitude of cranial bone movement. And with the existence of cranial bone motion established, elucidating the mechanisms behind the craniosacral dura and the serenal spinal fluid, they were integrated into a comprehensive model, which is what we know today as craniosacral therapy. So the dura matter itself has attachments onto the bone, i.e. the spine. The dura matter, which forms kind of the sac, it's like a tadpole-shaped structure with the larger bit being around the brain, then it stretches out downwards from there. It's a part of this hydraulic system that's attached to the inner lining of the parietal bones, the temporal bones, the frontal bone, the occipital bone, and the sphenoid bone. So the parietal bones are at the side of your head. The temporal bones are at the temple. The frontal bone is at the front of the top, just above your eyes. Occipital bone is at the back, just at the top of the neck. And the sphenoid bone sits a little bit deeper, kind of behind the eye socket. But if you get hit in the temple, that's part of the sphenoid bone. It also has a few attachments into the ethmoid bone, but it's not as its lining. So the dura mater forms the tube, which runs downward through the vertebral canal. Within the canal, its only bony attachments are the posterior bodies of the second or third cervical vertebrae, so C2, C3, and the posterior body of the second sacral segment, or S2. Then it exits the vertebral canal through the sacral hiatus and blends with the periosteum of the coccyx. The dural tube within the vertebral canal is also firmly attached to the foramen magnum of the occiput, so where the spinal cord goes up into the actual skull. Otherwise, the dura attachments are either soft tissue ligaments or the dentate ligaments at C1, which allow for some movement of the dural tube into the foramina formed by the vertebrae for the passage of spinal nerve roots outside the spinal canal. Now, in the brain, you've got what's called the falx cerebri, tentorium cerebelli, and the falx cerebelli. All represent dura mater, so the dural membranes inside the brain, which are formed by the dural membrane separating from the skull bones and reduplicating upon itself to form portions in the skull. These structures also provide much of what is used in the formation of the venous sinus system in the skull. We have many sinuses in the body, but what I've found clinically is that these attachment points from the dura to the bone often will be a major player in people's symptoms in the extremities, feet, lower back, shoulders, sometimes eyes as well. So it's actually tension and torque, so rotation through the dura, that often presents with these unseemingly related symptoms. But what a lot of people will do, and this question came up in class, is when a patient sitting supine or laying face up, you grab the base of the skull and gently pull it towards you, causing cranial traction. If the head wants to rotate any way, that's essentially kind of dural torque 101, and that's an indication that there's dural tension within the system. We can't really get away without talking about the fascial system. I know fascia is a huge, well, it's almost its own industry now with the anatomy trains and I can't think of his name. Rolfing plays a huge part in fascial release. But the fascia of the body is the tough connective tissue which holds us together. It keeps our livers from falling out, our lungs and heart from exploding, our intestines from falling down into the bottom of our pelvises, and it envelopes each and every structure of the body. Even the tiniest nerve has its own fascial sheath or envelope, as does the largest bone. About half of the muscular attachments of the body are to fascia. So that muscle tone or the state of contraction have a lot to do with how tight or loose the fascial sheaths and envelopes are in certain areas of the body at any given time. So when you're doing a lift at the gym, probably about 80% of that lift is the fascia. So fascia has been described in various ways. It has been called the body stocking under the skin, which helps hold us together. It has been described as tubes within tubes within tubes. There's also been given a series of lamina which cohere, separate into envelopes, and then cohere again. In the latter, each body structure has its own envelope formed between the fascial lamina. All of these views are appropriate and correct to some degree. The superficial fascia does form a body stocking, and the meningeal layers are tubes within tubes within tubes. And each body structure, or viscus, meaning organ, has its own private envelope of fascia, which is formed by the separation of two or more fascial lamina. But the biggest part of present-day fascial work, we'll call it, is regarding the fascial layers, which for optimum health must slide on itself for normal function but can't get glued together. And when they get glued together, they lack this mobility. So that is that micro trauma I was telling you about. But for many years, notions about tissue glide were based on the idea that tissues organize themselves in virtual spaces in more or less concentric lamina altogether, suggesting that the tissues were, you could say, stratified and well individuated. But when you it's going to sound weird. When you see a cadaver, you see it's all just one tissue. It's not 360 odd muscles hanging out in separate places. It's one muscle, one tissue hanging out in 360 odd places. So essentially, any work done, be it visceral manipulation, craniosacral therapy, massage therapy, if there's any kind of tissue release, then that is usually done by the fascia. And I can tell you how to release the global system in a little bit. But then I know in massage therapy school there's a big big debate whether how do you know a tissue's been released. Well, tissue release is the name that's been applied to the sense of softening and relaxation that is perceptible when a technique is in use or has come to a successful completion. But that doesn't mean the whole session is over, just that sort of one phase is finished. But there's many factors that affect the release. So some factors can be, relaxation of the nervous system, which have produced increased tissue tone. You get a sense of increased passage of fluids through the tissues, and that's probably more felt under the therapist's hand. You also have like an increased flow of energy through the tissues. You have kind of like an emission of increased heat radiating from the appropriate body region. A sense of repelling force can be perceived as well when the therapist goes in too hard. So around the neck, for example, a lot of massage therapists will go hard around the neck to try and break the little micro lesions up. But there is a lot of anatomy in the neck, and most people will have a response of that by sort of trying to hide into their rib cage like a turtle. But that increases tone and the opposite effect of what the therapist is going for. But you'll know you've had a good little release when you feel a softening, you feel like a lengthening, which means you're into the collagen fibers of the fascia, have increased fluid and energy flow, maybe a little bit of heat, which is like a therapeutic sort of backburn, if you will. Sometimes you get like what feels to be like an energetic repellent, so it feels like opposing magnets. You get that big sigh, that's a sign of a good release. And you also have what's called a therapeutic pulse, which is a phenomenon that you find on many occasions when the body is in the process of a self-correction. It may occur anywhere on or in the body under a treatment, but the amplitude of the therapeutic pulse seems to increase from kind of near zero until it comes into the conscious awareness of the person. And it's not necessarily a bad thing. In fact, that pulse may last for seconds or a couple of minutes, but in its presence seems to indicate that something good is occurring. So after the self-correction is complete, you find the therapeutic pulse diminishes in amplitude until it becomes sort of imperceptible or invisible. But I always see it as a good sign, and it's always followed with a sigh and then normalization of the tissues. So how can we work with this system? How can you do it on your own? Well, as time has come where I tell you. So hopefully your left brain has been satiated with all that. Now, what we can do if you suspect that you have dural tension, be it torqued or otherwise, is we can induce what's called a still point. Now, a still point is a craniosacral term, but the still point is used as a balancing technique for the craniosacral system. It will also remove transient and minor restrictions with only a few kind of applications, really. But theoretically, use could remove most intradural restrictions, because if you direct and change fluid forces within the system repeatedly, most restrictions will succumb and just release. So the still point is used to release accumulated stress. It's got a profound relaxing effect on the autonomic nervous system. Thus, it is beneficial with most hyperautonomic problems, from high blood pressure to, let's say, a peptic ulcer. The still point also improves fluid exchange between the various physiological compartments of the body, as well as improving blood flow by reducing sympathetic nervous tone. Occasionally, the still point induction will dredge up some old pains that you thought had quote-unquote gone away, but this is quite good. The old pains haven't disappeared. They were just simply dormant and waiting to reappear at another more inconvenient time. But the dredging up offers opportunity for total correction of that problem at the time. So you can do this still point induction at home. All you need is 2 round objects, 2 tennis balls, 2 golf balls, something like that. Then you put those right at the base of the skull. I'd recommend using a stocking or some kind of sock to hold them together, otherwise they will separate and fall away. And all you need to do is put them there, lay down on the ground, do some breaths, and relax for about 15-20 minutes. And that's how you can create a little bit of still point induction. And it's a technique I use with patients. You can also use it with your hands. If you want to treat your partner, just have your hands in kind of a cup shape on the base of the skull, and if you're really sensitive enough, you'll feel all the energy go in towards that point into your hands, and then it can be a few seconds or a few minutes later, you will just feel the whole system expand and relax. And that's when you've sort of reset the autonomic nervous system. And I've had really good success with patients doing that. People's pain go away, people's anxiety disappear. Even once a depression patient felt a lot better. And it just feels the weight of the world just sort of lifted off your shoulders just a little bit. And sometimes that's just all we need, just a little bit of relief. Because our nervous systems are wired to survive. And in this fast-paced world of having to do everything for everyone, and cultural pressure and family pressure and work pressure and maybe even relationship pressure and all that gets stored in the tissue. And if it's not released, it creates pressure. That pressure eventually blows up. Something has to pop. And that pop is what we call injury, it's what we call pain, it's what we call disease. And it's a nice little present you can give to yourself. I would encourage everyone, except if you've got increased, intracranial pressure, if you've had an acute stroke, cerebral aneurysm, maybe a hemorrhage, or like a recent skull fracture or a cerebral spinal fluid leak, that might not be a great idea. But for absolutely everyone else, safe to do, healthy to do. And I think initially I would probably recommend every day or every second day. And then once you feel you've got that reset sorted, then you can go out and maybe once a week or however often you feel necessary. So hopefully that's my little gift for you today, in a way you can sort of be your own therapist. And a lot of people don't know just how stressed they are. And a few ways you can tell if you are in fact stressed. You might not feel it consciously, but your body is in fight or flight, is one way. One way you can tell is if you hold a piece of paper in the palm of your hand and just hold it out in front. If that paper is shaking, that's an indication of stress, and that's what jet lag looks like. Another way is you can take your pulse, your radial pulse on each side, and feel how strong, feel the amplitude. You can even time it over a minute. See how the pressure feels within the artery. Take it on both sides and compare. If it's uneven, or if it's diminished on one side, lower on one side, less on one side, that's a sign of not necessarily ill health, but like an engine that shakes when you drive the car. So that's a good indication to do that. Even putting your hands on your ribs to find your respiratory pulse. Just feel the quality between left and right, the amplitude, the volume. All these things indicate just how well the body is functioning. And if we can help it out just a little bit every now and then it can go a long way into our longevity. And hopefully you don't have to go from therapist to therapist, doctor to doctor, to get all these sort of chasing symptoms adventures. So I hope that helps everyone. I'd love to know how you went with all that. If you're enjoying the show, please feel free to leave a nice comment. We have some fun guests coming up over the next few weeks. So I look forward to sharing more with you then.
You've been listening to The Wizard and the Priestess. Thanks for stopping by. Stay connected and be open.